Hello guys, welcome back. In today's video, I'll be discussing about a video that I saw online. I know that each and every one of you must have come across the video on this TikTok platform. It's about a lady that was crippled while she was pregnant. So in this video, I'm gonna explain what actually happened to the lady and how each and every one of us can help anybody that we know that is passing through the condition right now. Stay tuned from the beginning up to the end of this video for you to learn something. I know you will definitely learn something. I'll use some minutes to play out the video so that you'll be able to see the video why I. So guys, I hope you watched that video. So you have seen the testimony that the lady shared on how she was crippled throughout her pregnancy. So that leads to the topic I'm about to discuss today. I think that lady suffered from a condition known as symphysis pubic dysfunction. So in this video, I'm going to explain what symphysis pubic dysfunction is and how to treat and manage someone with that. All right, what is symphysis pubic dysfunction? It is a condition that causes discomfort and instability in the pelvic region. It is commonly experienced during pregnancy due to a hormone known as relaxin. This relaxin is responsible for softening of the joint, the pelvic joints during pregnancy to enable easy passage of the fetus during childbirth. So, why this hormone acts on the pelvic region? It can also most time cause flexibility. So that increased flexibility can lead to misalignment and pain around the pubic bone, the lower back and the groin areas. So this can cause excessive pain and even lead to immobility at times, as you can see in the case of that lady. So that is as a result that of increased flexibility caused by relaxing hormone. What can be the possible symptoms of someone experiencing pubic symphysis dysfunction? The first one is inability to move, that is immobility. The person is not able to move while in bed or even stand up, pain while walking, pain while climbing the stairs, and performing your routine activities. So this pubic symphysis, the first thing it does, it affects the quality of life. It's it, it, it causes disability, you not being able to carry out your daily activities. So what can be the management of this pubic symphysis dysfunction? The first one is pain management. It includes doing gentle exercise by a healthcare provider, cold compress, and the use of pelvic supportive belts. This can help to reduce mobility and relieve the person's pain. So another management is the physical therapy. A physiotherapist is recommended to help you strengthen the pelvic muscle and improve your stability. So we recommend physiotherapists to help you increase mobility. Another one is rest and support. You should reduce activities that worsen your pain. You should use pillows to support your your waist while sleeping and practicing proper posture to alleviate your symptoms. So another management is by medication. So your doctor will recommend so many pain relief meds that can help reduce your pain and relax the muscle. So another thing I want to add is that while you are pregnant and you are having this symptom, don't be discouraged. This symptom usually gets better once the baby is delivered. You see yourself improving and you are back to, before you know it, you are back to your feet. So what can be the complication of this pubic symphysis dysfunction? What can happen if you leave it untreated? All right, what are the complications of syphilis pubic dysfunction? The first one is increased discomfort. Without proper management, the pain and discomfort that is associated with this pubic symphysis dysfunction can intensify, affecting your daily activity and even your quality of life during pregnancy. So the second one is reduced mobility. Why you leave this symphysis pubic dysfunction and you are not treating it, it can result to reduced mobility. That is, you are not able to move around during pregnancy. So in severe cases, you see the person has challenge walking, climbing the stairs, and even performing daily activities. So most of times, this person can be confided in bed and not being able to move around when not treated immediately. So it has also has impact to labor. It sometimes influences the labor process and causes potential difficulties during labor and during your pregnancy. It can cause a lot of difficulty while you are carrying the pregnancy and also during labor. Another one, it can affect your emotion. So while you are not able to move around, you're constantly having pains. So you see yourself always worried, deep in anxiety, pain, and sadness, deep sound sadness inside of you. You are not happy throughout the pregnancy. So this condition generally affects the quality of life of the individual affected. So that's why you need to help out if you have a relative that is passing through that condition while she is pregnant. That person needs a lot of your support right now. So you help out with activities, home activities, ensure that the person rests and de- and have and stays in a position where there is decreased mobility so that it will alleviate the pain and discomfort. Another thing I will discuss in this video is the risk factors. Who and who are at risk of this pubic symphysis dysfunction? The first one is if you have had this pubic symphysis dysfunction in your previous pregnancy, it is likely to occur again because it is actually caused by pregnancy. If you have had it before, there is chances that you will still have it again. Then another one is multiple pregnancy. If you are carrying twins, triplets, and so on, so this can increase your chances of getting this condition. Another one is high level of relaxin hormone. In some individual, this hormone can be very high, leading to softening of most of their bones and joints, so to increase the risk of getting this condition. So maybe the lady in that picture has this high level of relaxing. Another one is joint hypermobility. In pregnancy, if there has been an pre-existing hypermobility of the joint before pregnancy, so this can increase your risk of having this symphysis pubic dysfunction. Another one is excessive weight gain. Rapid and excessive weight gain during pregnancy can put pressure on the pelvic area. Maybe you are carrying a very big baby inside of you. This can put a lot of pressure on the pelvic region. And you, if you have an excess weight in your body, you have gained a lot of weight, while pregnant, it can affect the joint due to the hormone that is reacting on those joints, and your increased pressure can cause symphysis pubic dysfunction. Another one, strenuous work. While pregnant, if you are engaging in strenuous activity, remember that your joints have been softened by a hormone known as relaxin. So, while you engage in strenuous activities, it can pose more risk of having this pubic symphysis dysfunction. Another one is muscle weakness. If your muscles are weak, you have chances of getting. So in today's video, I know you have learned the causes, the risk factors, and the complication of not treating this condition. So if you suspect that anyone around you or you yourself is experiencing any of these symptoms, the first thing you should do is to consult your healthcare provider, your doctor, so to ensure proper management of this condition. Thank you for watching today's video. If you find this video very educating, don't scroll without giving me a thumbs up, commenting and sharing my videos. Thank you.